Hi, I'm Francis.
And I'm Hodo.
Together we are going to explain the different types of asthma inhalers and the anti-doping status of the drugs they contain. Different inhalers have a different anti-doping status depending on the medications they contain and the doses at which they are prescribed. Some are permitted in sport whilst others are prohibited. For this reason, it is especially important that athletes check their asthma inhalers on Global DRO regularly. For example, when they are first prescribed their medication, whenever their medication changes, and at the start of the new year.
Preventer inhalers are used every day and are the foundation treatment of asthma. They help to stop or prevent symptoms by reducing the inflammation in your airways. Some preventer inhalers contain only one medication called an inhaled corticosteroid. One example of an inhaled corticosteroid is beclomethasone, which is contained in this inhaler. On the WADA prohibited list, inhaled corticosteroids are referred to as glucocorticoids. Some other preventer inhalers contain a combination of both an inhaled corticosteroid and a long-acting beta-2 agonist. An example of a long-acting beta-2 agonist would be salmeterol or formoterol, and they work by preventing or providing relief from symptoms such as breathlessness and wheezing. And this inhaler contains both an inhaled corticosteroid and a long-acting beta-2 agonist.
Preventer inhalers that contain only inhaled corticosteroids are permitted in sport. This is because glucocorticoids, as they are referred to on the prohibited list, are permitted in sport when they are administered via inhalation. That is, administered into the lungs via an inhaler. You do not need a TUE for medication that is permitted in sport. Prevent inhalers which contain long-acting beta-2 agonists in addition to inhaled corticosteroids are also permitted in sport when used up to a maximum threshold defined in the prohibited list.
An athlete will need to know how much medication is contained in each puff and how many puffs they use a day in order to work out if this falls below or above the prohibited threshold. One way to do this is to look at your product packaging, where you'll be able to find how much medication is contained in each puff. And then if you know how many puffs you're using overall in a day, then you can work out whether this will fall below or above the prohibited threshold. Reliever inhalers contain a short-acting beta-2 agonist medication, usually either salbutamol or terbutaline, and these are used when needed for breakthrough symptoms such as wheezing and breathlessness.
Salbutamol is permitted in sport when used up to the maximum threshold defined in the prohibited list. A TUE would only be required if an athlete goes above the maximum threshold, for example, during an asthma attack. In this scenario, the athlete would be expected to apply for a retroactive TUE. Athletes must pay close attention to how much they use their salbutamol inhaler to make sure they don't go over the maximum threshold, unless there's an urgent medical need to do so. Otherwise, their TUE application might be rejected. Terbutaline has a different status. It is prohibited in sports at all times regardless of dose. Therefore, an athlete must make sure they apply for a TUE before using terbutaline. Athletes that are prescribed terbutaline must check with their healthcare professional whether they can be prescribed an alternative beta-2 agonist that is permitted in sport. Otherwise, their TUE application might be rejected.
Athletes must always use their inhalers in accordance with their prescribed treatment plan or their asthma action plan if they have one. Ideally, if their asthma is well controlled, we would not expect them to have nighttime symptoms or to need to use their reliever inhalers very often. However, if an athlete is finding themselves using their reliever inhaler more regularly, such as 3 times a week or more, this may mean their asthma is not well controlled, and we would recommend they visit their healthcare professional managing their asthma for a review of their medication.
In this video, we've covered asthma inhalers and their status in sports. If you are an athlete or athlete support personnel looking for more information on managing asthma and anti-doping responsibilities, visit UKAD's website.
And for more general information on asthma, you can visit the Asthma Lung UK website. There are some great resources on there. Thank you for watching this video. We hope you found it useful.